Thanks for the introduction. Apologies, I can't be there in person, but I'm just going to give a bit of an overview and an update on the ConNeCT study. So this is our study looking at the neurological complications of TTP. So the lead site is in Liverpool and sponsored by Liverpool University Hospitals NHS Foundation Trust. And as Pip mentioned, Dr. Tina Dutt is the chief investigator of the study. So ConNeCT is a UK multi-centre observational study. ConNeCT's been designed with patient involvement right from the outset. So we had our local TTP patient support group involved right from the very beginning. They were feeding back on study design and the design of the questionnaires, and they were involved in a pilot study as well. On top of that, we've also had the UK TTP network involved and been giving updates to them. So patients really are at the centre of this study. It's a questionnaire-based study, very straightforward. It's 6 to 12-month follow-up questionnaires, and we're recruiting patients with TTP diagnosed at any stage. So this includes new diagnosis, but also patients with a historical diagnosis of TTP who are being followed up in clinic. As a comparison group, we're also recruiting healthy volunteers into the study. And these are like basically any non-blood relatives, friends, carers of the patients who are, we generally recruit them also from the haematology clinics. Since we've had HemeStar support, it's been really, really great. We've had increased awareness nationally, and this has led to opening of new sites and also increased recruitment for ConNeCT, as we did open right in the middle of the first wave of the pandemic. So you can imagine the usual challenges that we faced over the last couple of years. Just also to mention while I'm on this slide that ConNeCT is also registered for the NIHR Associate PI scheme. And this would be a really great initiative, and also would be great, another reason to open new sites if you could get people involved and get an extra pair of hands through this Associate PI scheme. So we have had an extension of the study, so we're now recruiting up until August 2023. Our recruitment target nationally is 200 TTP patients and 50 healthy volunteers. I'm really, really pleased to say that we've now recruited 96 patients nationally, which again, I think is a really great achievement considering the challenges of COVID, but also because we're recruiting for a rare disease. The sites that we have open currently are Liverpool, Oxford, Bristol and Nottingham. We have many more sites that are in setup at the moment, including Birmingham, Cambridge, Glasgow, Coventry and Warwickshire. I've put Cardiff in brackets because they've had staff sickness, so if anyone is based around there and wants to get in touch to help out, please do contact me. We are happy to talk to you about opening your site. So if you look after patients with TTP and you're interested in participating in ConNeCT, then please do get in touch for more information. I've left my email address there. We'd be really delighted to hear from anyone who wants to be involved. So thanks very much. I'm happy to take any questions if there are any.
So the first question for those online is it a self-directed questionnaire the patients fill in themselves, or does it need a healthcare professional there in the room to take the patient through it?
So basically there's a bit of both. It's predominantly patient questionnaires that they can fill out themselves. So what we've generally been doing is catching people in the waiting room while they're waiting for their clinic appointment, and it gives them something to keep them occupied whilst they're waiting. There is also a healthcare practitioner questionnaire as well, but this is just one questionnaire for the clinician and the rest are for the patients.
Your healthy volunteers are likely, due to the fact who they're going to be. Are they going to be other patients? They're going to be hospital staff members who are likely to have a very different educational background to the patients who may well have missed significant portions of education, maybe as a result of their condition, if they've got congenital TTP or had it young early on in life. Is there a way that you are adjusting for that?
Yeah. It might not have been clear enough from the presentation. So the healthy volunteers that we're recruiting are non-blood relatives, friends or carers who come with the patients to the TTP clinic. The idea, so not clinic staff. The idea behind this was to try and get reasonably well matched controls that come from a similar socioeconomic background of a similar age as well. So that was the way we were trying to, as best we can, to make up for the fact that there may be differences between the patient and control groups.
One other question on the chat. Do you have to get a control with every patient recruited?
No, definitely not. We were working on a ratio of ideally 4 patients to 1 healthy volunteer, but we won't hold you to that. We're just happy to take as many participants as possible, whether that be patients or healthy volunteers. So it definitely doesn't need to be 1-to-1.